Too many business leaders believe that the rising cost of health insurance is unavoidable. As a result, more and more of your hard-earned revenue goes to helping health insurance companies get bigger and bigger every year instead of your own business. And that's just plain wrong. But here's the good news. You can control the cost of your health insurance and keep more of that hard-earned revenue. Just imagine, what would you do with the revenue you would get to keep if you were able to control your health insurance costs? Welcome to day 2 of the Magic Minute, the video series where you learn cutting-edge strategies to control your health insurance costs so you can grow your business and improve your bottom line. My name is Bill Geraci, and I'm the president of Magic Health Insurance Solutions. We've spent the last 14 years helping business leaders, just like yourself, take back control of their health insurance costs. I think it's a shame that most business leaders feel stuck with their traditional health insurance options. I'm excited to introduce you to today's new cutting-edge strategy so you can start controlling your costs without sacrificing your business growth or your employees' coverage. Today we're going to talk about a health reimbursement arrangement, or HRA. As we discussed in the welcome video, almost 90% of small businesses fully insure their health insurance plan. This means they have chosen to assume no risk and completely transfer all of the risk to the insurance company. They simply pay their monthly premium and the insurance company takes care of everything else. Now, a key component to taking control of your health insurance costs is to assume more risk, but this can feel scary for many small business owners. They want to control their costs, but they also really like the security of a fully insured plan. Well, there's no way around not assuming some risk if you want to control your costs. However, strategies like an HRA help you control costs while also limiting your liability exposure. Implementing an HRA is one of the easiest ways to start controlling costs while remaining fully insured. Let me explain how it works. Insurance works on a simple rule of thumb. The lower the deductible, the higher the premium paid. The opposite is also true. The higher the deductible, the lower the premium paid. An HRA uses both rules to help you generate savings. Let's say your company offers your employees a low deductible plan. Based on the rule we just reviewed, your plan is going to have a higher premium and cost your company a lot more money to offer. But if you want to implement an HRA, to do this, you need to do 2 things. First, you will need to purchase the highest deductible plan offered by your health insurance company. As we know from our rule of thumb, your new premium cost will be much lower than your current premium for the low deductible plan. The wider the gap between your current plan and the high deductible plan, the more premium savings you have available to use with the HRA. Now, the second step is the cool part. Instead of making your employees take the high deductible plan, you allow them to keep the current plan. Yep, you heard me correct. In essence, you end up with a plan within a plan. Your employee's low deductible plan within your company's higher deductible plan. Obviously, there's a gap, right? And you're probably wondering, how does this work? Well, your employee is responsible for costs up to their deductible as they currently already are. You, the employer, are now responsible for the costs incurred in the gap between the 2 plans. You will use the premium savings from purchasing the high deductible plan to cover the cost incurred in this gap. In essence, you are reimbursing the employee or the other members of the plan for these costs. Thus, the name Health Reimbursement Arrangement. So, the next question you might be thinking is, but how does this actually help me control my costs and save me money? Well, a certain aspect of health insurance are pretty predictable. For instance, we know that in any given year, roughly half of the members don't even use their benefits. We also know that a very small percentage of members meet their deductible and out-of-pocket obligations. Using this information, we can project you will reimburse a very small number of employees who incur claims in this gap. In the end, you'll have money left in the premium savings pot you created from buying the higher deductible plan. Instead of paying as if everyone covered by your plan is going to meet their lower deductible obligations, you're using the odds to control cost and save revenue. You're using a smart risk management technique. You win, the employee wins. Who doesn't love that? Here's an example of how one small business was able to control their costs with an HRA. One day we received a call from a metal fabrication company that had 37 employees on their fully insured plan. They had heard from a few of our clients who were their friendly competitors how we were saving them money, so they gave us a call. They had just received a 14% renewal increase. This was on top of a similar increase they had received the year before. Obviously, the owner of the business was understandably upset. His company was in a tough spot and he was desperate for any idea to get this cost under control. We learned through the evaluation process that they had a member with active cancer. This definitely limited our options. But they also had a $3,000 deductible plan, which meant we had some room to generate savings through an HRA. Based on our projections, we were able to show them how they could reduce their 14% increase to only 5.5%. This was a savings of almost $25,000. By implementing an alternative funding strategy like an HRA, you can control your health insurance costs and keep more of your hard-earned revenue. In our next video, we will introduce you to a concept that provides even greater savings, the level funded plan. If you're ready to stop dreading your next health insurance renewal meeting and start taking back control of your health insurance, let's have a conversation. Give us a call at 844-800-MAGIC. And don't forget to subscribe to our YouTube channel for more great content. See you tomorrow. Thanks.